Hey, it's Tami Lynn Hancock. So today is day 5 after having major surgery, and I haven't posted a video in a couple days, but wanted to share with you guys a little bit about the ovarian cancer journey that I'm going through. And I can't, for some reason, switch the video. I'm still in the hospital. I'm going to show you a picture of my stomach. I hope you can see it there. Sorry, that was a quick picture, but I can't see what you could see. Let me tell you what you're going to expect. When I first got diagnosed, I started with right rib pain, and then I ended up, about a month later, having significant ascites or fluid buildup in my abdomen, so that I went from a flat stomach to looking 7-8 months pregnant. A lot of pain. It would feel like really bad menstrual cramping pain. And so I was able to work for a week before I went back in the hospital. Well, till I went to the hospital. But the week before my surgery, it was too painful for me to walk. I had to walk hunched over, very short of breath. I took a combination of CBD oil and Lortabs. And I want to just remind you guys, pain medicine, take your CBD oil, get with me. I will put a link at the end of this video, a good CBD, a reputable CBD company. Having used it myself and used it before my surgery, I can tell you that it absolutely does work. So, went in to see my gynecologist. I'm kind of updating you. That week I was home, and he confirmed the CT scan that he was really going to go from the left to the right, and to his best, he knew, as I did, that there was ovarian cancer. But he would know the extent and stage it and do a pathology when they went into surgery. So I came in on the 21st, which is today's the 27th, for surgery. I was looking forward to that because all I could do was go from the chair to the bathroom. And I want to remind you, please take Senna S Plus or Colace. You got to keep your bowels moving. Okay, so went into surgery, and the doctor pretty much told me he was going to take everything out from the left to the right that had cancer in it. Now, you may have had friends who had hysterectomy. That's a pretty invasive surgery. You're going to have that midline incision. The midline means goes right down in your belly button. And they split you, they open you up, and they're going to take out, if they're going to do a hysterectomy, your uterus, it's a big organ, fallopian tubes, your ovaries, that kind of stuff. So when you just think of that picture when we were in high school, that's a pretty big organ just to take out. But while I call it roto-rooting, while he was in there for me, they're gonna look, because of the CT scans and the ultrasounds, they're gonna get out as much cancer as possible. When they tell you major surgery, I had a tummy tuck. This is not like the tummy tuck. It's not like having a C-section, although I didn't have a C-section. It's just major. So for my case, they took out the hysterectomy, everything I just described. They took out my appendix because they had cancer on it, so I had an appendectomy. They took out a little bladder tumor on my bladder, scraped that off my bladder, scraped the tumor off my intestines, and then cut pieces of my intestines and sewed them back together. So there's a lot of organs taken out. Hysterectomy is a pretty big surgery. When they go in there and they're cutting things out and scraping and going in there and taking your little organs and snipping that one and moving this one, tossing this one around, it's a lot. So He said he got 99.9. He was not able to put the abdominal port in. I can't remember how much fluid they got out from the fluid buildup or the ascites. So you wake up from surgery and you're on morphine and a lot of pain. Just let your nurses know you're in pain. And, you know, they get you up and walk, and that's a good thing. Monday, Tuesday, Wednesday, you kind of lose track of time. You're going to need somebody to be with you at the hospital because it's major surgery. If you can't think for yourself real clear, it's major surgery. And if you have as much done as I had or more, you're not going to recover in 5 days. So you're going to be there 7 to 10 days in the hospital. Before you go in the hospital, I took my hair and I French braided it. And I started at the top and I French braided it down. Do that because your hair will turn into a rat's nest. So have someone do that for you. Now it's still French braided, but it's clipped up in the back. I brought in a little blush, a little makeup, my perfume, my toiletries, because that was part of having me live normal. You're going to be without foods for several days. I started eating some foods on Wednesday. When I say eating, I would say, let me get my peaches here, show you a little scoop of peach. Oops. That's eating. Ice water, I really like. So you drink, you're going to be on IV fluids for a while. You're going to have a Foley catheter inside you. Those are good things. Believe me, you do not want to have to get out of bed and pee. They're going to get you out of bed to walk. And I think I pushed it too fast. I walked a little bit too fast. And then my pain got ahead of me. So I want you to think of pain as a pain ladder, 1 to 10. When you're above 5, you want to keep your pain down. I was letting, and I was not letting, but my pain would get out of control, and it would hit me up to pain level 7, and then it takes longer for the meds to work. So that's important. They're going to give you a little tube to breathe in and centispirometer. It is going to hurt like you never knew hurt to cough and spit up stuff, but you need to do it. I cannot tell you how much I hate coughing, and I would sit up at the side of my bed and the pain would just explode in pain, but I had to cough and get stuff. We have normal mucus in our lungs, and if you don't cough that stuff up, you're going to get pneumonia. So you have to not give up here. Mindset is a big key. I do a lot of teaching and training in attraction marketing, and mindset is what I talk about there all the time. But mindset with recovering through your ovarian cancer is critical. For me, I think I told you they took 99.9% of the cancer out. I have not had a dose of chemo yet. I'm not strong enough yet. But I wanted to prepare you a little bit for some stuff. So you're going to go from not eating. They're going to take your fluids off. Are you going to swell? Yeah, your legs are probably going to swell. They're going to give you shots in your legs to keep you from getting blood clots. They're going to try to get you up, walk when you can. I'm going to try to get up today. I haven't walked yet today. And I don't walk real far, but I try to walk. You have to push yourself because the only person who has the mindset to get through is going to be you and me. So you can do this. I can do this. Is it hard? Yes. Sometimes it's hard getting through 4 hours. But this is just the beginning of our journey, and we have to remember that we just didn't have a pimple removed. We had massive surgery, and so there's going to be swelling as our body's going, What happened? You took out all these organs, you jostled you all around. I'm an RN, and I have had a hard time remembering that. I've had medical training, and I need people to remind me, you had a big surgery. So, one of the things I was speaking about a few minutes ago is you need to have somebody be there. Now, today is the first time I've been able to talk aloud. And if this isn't loud to you, it's really loud to me. I have been only talking like this up until then because I couldn't get out any volume. Ooh, I got the stickers still on me. You get lots of stickers left all over your body. So have someone do that. When I say you need someone because you won't be able to reach a tissue. And speaking of tissues, go get a box of Puff Plus. You need a nice, strong tissues. The tissues they give you in the hospital, just throw them away. Because when you blow your nose or you cough up some stuff, and you're going to need a good tissue. Do some nice things for yourself. Have someone there because it'll be hard for you to blow your nose because you have had the surgery. It's painful. It's hard to breathe. Until you get your pain under control, you're just miserable. And push through it. If you have inspirational tapes, put that music on. For me, it's my faith in God. Hanging on to my faith in God, praying to God, saying, there were times that I just said, I laid hands on my belly and I said, the pain is too intense and I can't deal with it anymore. I need your healing hand to stop the pain. And so that you can sleep. You will feel like sometimes you can't sleep at all and that you've gone, you've dozed, but that restful sleep. You're going to need chapstick. I want to tell you that too. There are going to be times that even though you have an advocate there in the room with you, your family member, you can't reach a pillow. You can't put your socks on. You can't, when you have a bowel movement, you can't clean yourself. You will, but not now. Coughing, you have to splint it, your tummy with a pillow. So, I'm telling you all this so I can be an encouragement to you, to walk you through, to say, how to get through it. I've been having flashes of hot and cold. Right now I'm having a hot flash. It could be to the hysterectomy. But it's just that my organs and my body's responding to the shock. Sometimes you won't want to see people, not because you don't want to see them, but today's the first day I've been able to communicate. I don't mean that I couldn't communicate, but I wanted to listen, but I didn't want to talk. And of course, everybody wants to know how you feel. And you won't be able to express how you feel. And you'll find that that's an inner frustration, but you will get past it. I remember a couple nights ago, I was just laying in bed. My husband was sleeping on the chair next to me. And I just praying to God. I have a very strong faith in God. That is what gets me through. And I don't know what the next weeks and months, we'll go through this journey together. And, just verses would come back to mind. And this one song, Jesus' blood never fails me yet. This one thing I know, that he loves me so. Oh boy, I'm going to cry. When you're in the hospital and you're trying to communicate and you can't, it's frustrating. And you can't really cry, although I am crying a little bit now. But you don't want to because I feel like I have to control it so I don't hurt myself. So there's a gamut of emotions you go through. But don't stuff them in. Share it with people. Let your family text your friends. You don't have to, I turn the phone off. I don't take phone calls. I text when I can, but I just have my family just text back people for me. If you can read, read. For me, I can't concentrate enough to read. So I watch a lot of TV and I just have noise. So I know I'm rambling a bit. I'm just trying to share so that you have an idea of what's going on. Don't be afraid, as I was saying, to express your emotions, your fears, your frustrations. I'm still at peace. I'm not. I'm not angry. I'd say my biggest frustration is just that I'm feeling helpless, and that bothers me. As a nurse, it helps me to be a better patient. So anyway, I'm gonna sign off for now. My husband just came back with a cup of coffee. I hope this was helpful to you, and we'll talk to you later. God bless.